What is the best treatment for somebody who's thrown out their back? In a previous video, I talked about what does it mean to throw out your back, and I talked about how a lot of times it is a muscle spasm, a protective response that could be happening for a few different reasons. So in this video, I'm going to talk about some treatment options and really discuss each of these treatment options in relation to maybe what is going on with you in your particular reason why you have a thrown out back. So for a lot of people, I talked about it's just an overexertion. You've used certain muscles in your low back that you haven't used in a long time. Say you were shoveling snow, say you were helping a friend move a couch, just whatever it is, but you've done something and you haven't done that in a while, and those muscles just locked up on you. In cases like that, traditional chiropractic adjustments, the adjustments where a chiropractor puts you on your side and adjusts and realigns your spine, really they're just mobilizing those joints. There is a neurological reflex that allows those muscles to just relax after you get adjusted. So for a lot of people, they get one of these spinal manipulations, these adjustments, and they feel extremely better after they do that. Some other options could be ice to control inflammation. You control the inflammation, you control some of the pain, and that muscle spasm will reduce a little bit. If it's not inflamed and it really is just a really tight spastic muscle without the inflammation, heat might be a better option for them. Muscle relaxers always could be a good go-to, but be careful with muscle relaxers. Sometimes it will help relieve the muscle spasm that you have going on, but for a lot of people, they're going to lose a certain degree of coordination, so you might be a little bit more susceptible to injuring your back again while that's going on. Of course, any of the over-the-counter rubs and balms that people put on their back could be an option as well. Okay, what if it's something else? So I had also mentioned one thing that can happen is the nerve. Right when it leaves the spine, sometimes that nerve swells up, it gets inflamed. And so now you've got this muscle spasm, this guarded, this protective mechanism around the area to keep you from moving in that area. So for somebody who's having some nerve pain going on, this is where you might want to find a spine health practitioner that can help you navigate the muddy waters of what's going to be the best stretch for you. Sometimes there are stretches where you lay on your stomach and you press backwards. If there's a minor disc bulge, a recent minor disc bulge for some people, that will cause that to go back into place. For other people, it might irritate their spine because if they're really, if it is swollen in there, you're also decreasing the space where the nerve comes through. So it's a technique worth trying and experimenting with. If you have pain going down your leg with that, do not do that stretch. For other people, it might be more of a laying on your back and bringing your knees to your chest. That's going to open up that space where that nerve comes through. And so for other people, that might be more of an option. And lastly, in the previous video, I mentioned sometimes it's these small joints on the back of the spine that got irritated. A lot of times with those, that adjustment that I had mentioned previously, those work extremely well again, it mobilizes that joint, gets the fluid going in there so that it can heal faster, but then there's that neurological reflex, which makes those muscles, those surrounding muscles, to not be quite so tight, so tense, and in that spastic state. And a couple of other small ideas, some people do well with what are called TENS machines. They put the little pads on there with the electric current. For some people, that will help reduce the pain and the swelling and the muscle guarding in that area. And sometimes there's a case to be made, do not stretch the back in itself, because for some people, they'll notice, boy, as soon as I try to stretch my back there, it wants to guard and rebound back. And in those cases, you stretch the surrounding muscles, you stretch the backs of your hips, you stretch the front of your hips, and you keep your spine pretty much in a neutral position. And sometimes when you start to stretch those hip muscles, again, neurologically, things will relax a little bit. And that really leads me to the final point is, a lot of times it's also time. There's a certain amount of healing that needs to do, and time heals all things. So the saying goes, so be patient and let it heal a little bit. And all of these other therapies that I mentioned are ways to get it to heal faster and to provide some degree of relief while it is healing. So hopefully you liked this video, you got something out of it, and gave you some options to try. If you enjoyed it, give us the thumbs up, like our page, and as always, if you have any questions, if you want to leave a comment, do that below and I'll answer those for you.